vaccination, and in particular for seniors, and really can't stress enough the importance of community-based organizations as the trusted sources for making sure that everyone, particularly seniors, particularly AAPI seniors, are able to get this vaccine. I want to just recognize some of the folks who are with us today. I'm thrilled that Assemblymember Ron Kim is here with us, an incredible leader in this community, in the city, and in the state. Dare I say, folks all over the country are learning about Assemblymember Ron Kim increasingly. Obviously, we have a team of doctors and professionals from SEPA, and I know that Ron, Assemblymember Kim, will mention some of the folks. We're also thrilled to be joined by Ellen Young and John Cho, themselves community leaders, activists, and candidates for City Council. So, my name is Jimmy Van Bramer. I'm a City Council member in Western Queens, and also, as you can see, a candidate for Queensborough President. But we're here today to call on the city to distribute more vaccines and resources to community-based organizations, particularly ones like SEPA, to help reach New Yorkers who are being left out of the current vaccination system. According to the city, only 17% of Asian seniors over 65 have received one dose of the vaccine. If we want to get over this curve and the pandemic, the city must prioritize expanding vaccine eligibility for all. No matter the language spoken, immigration status, income level, or access to online services. Last month, I wrote a letter to the mayor calling on the city to tap into community-based organizations. In my own neighborhood, Sunnyside Community Services, Woodside on the Move, Jacob Reese, all of these organizations wanting very much to be sites where folks can get vaccinated. They should be the ones to guide the further rollout of vaccines so that vaccines can get to BIPOC residents throughout the city. More than a quarter of Queens is Asian American, yet we are failing to provide adequate language access when it comes to vaccine appointment signups and translation services when folks do get their appointments. Currently, the New York City Health Department's website suggests using Google Translate to navigate the online appointment system and offers a Google Translate drop menu with select languages. The state vaccine appointment site is only in English. More than half of all households, thank you. Thank you, Ronnie. I got it. More than half of all households in Queens speak a language other than English. Without comprehensive language access, many Queens residents cannot navigate the vaccine system alone. If we want to reach every corner of Queens, we must mobilize and empower our local community-based organizations that can meet people where they're at. SEPA has tried. PIPA? They set up a pop-up vaccination site at Flushing Town Hall with Chinese language translators and primary care physicians. Last month, they received 550 doses of the Pfizer vaccine, but ran out within 2 days. CBOs play an important role in navigating the system for non-English speakers. At a time when AAPI seniors across Queens are struggling to recover from the dual pandemic of COVID and anti-Asian hate, we must do more to ensure that they are vaccinated. So I'm really honored to be joined by Assemblymember Ron Kim in this call today, and of course in the work that the Assemblymember and his team do for the community. So I'd like to ask Assemblymember Kim to say a few words.
Thank you, Jimmy. Thank you, Councilmember Jimmy Van Bramer. Thank you so much. And thank you, Jimmy's mother, for joining us as well, wearing the face mask, fully vaccinated. Thank you so much. We're here today with Kaipa, who have done so much of the work early on when the city and state and the federal government last year failed our community to test, to make sure that we get ahead of the curve. This is the organization that managed to work with various partners to bring in the on-site, the mobile testing centers. I was there with you last year on many of those occasions when we kept telling the city and state local authorities that we need to get ahead of this. We need to do more. We have the community-based infrastructure and the trust of our constituents who may not speak English, who feel very comfortable coming into offices behind me and working directly with the doctors. Google Translate on a website for vaccinations is not good enough. There's a reason why only 70% of Asian American older adults have been vaccinated, while close to 25% of the entire city of New York have been vaccinated. Our most vulnerable members are feeling still fearful, feeling distrustful, and they turn to KIPA, they turn to our community leaders, our elected officials for guidance, yet we don't have the resources and tools to help them. That's why I'm here with the borough president candidate who I support, Jimmy Van Bramer, to call on the city and the state to do better, that our communities matter. Our seniors, the most vulnerable members, matter. We know that during this pandemic and beyond, we are as strong as the most vulnerable members in our communities, but we still fail to take care of them. It's not right. So with that, first and foremost, I want to thank Jimmy for coming here and shedding light to this issue. And also, KIPA, Dr. George Liu, he's also an ambassador with the state. He's been appointed as one of the professionals to be a key ambassador to our community. But even with that, we need to do more. We need him to have the actual resource and tools so we can deliver that for our constituents. So let me bring up first Dr. George Liu on behalf of KIPA to say a few words. Thank you.
Thank you, everybody. Thanks for Jimmy and Brown King to come to the community to support us. And I think it's very, very important for whatever they have done for the community for such a terrible disease. First, I'm trying to introduce myself. I'm George Liu, the President and CEO of the Coalition of Asian American IPA. IPA has about over 1,100 providers and physicians, and we're taking care of about 500,000 Asian community patient contribution. It's very important to understand the situation that the disease has been really affect us, such a terrible situation, start from last year. KIPA has been the first organization actually proposed a press conference in January the 23rd last year to tell everybody how dangerous this disease is before even the first virus patient being identified in New York. And the time will tell everybody about the importance to gloves, to have social distance, cleaning hands, and masks, everything else in January 23rd. In February 7th and 8th, the Department of Health and CDC at the press conference. We are also in the conference to tell everybody in the general population, not just the Chinese community, the importance of the isolation, but the importance of the mask, social distance, all these things. It's so important to find out who are the ones who have carried the disease, so they will not be able to transmit it to the community, to the entire New York City at that time. And subsequently, we understand the situation is so serious that, we found that there's no essential PPE available for the hospital emergency room and the hospital first-line worker. And we actually start to fundraising and everything else at that time. Actually, we have been able to, this Chinese community doctors, provide more than $500,000 to support the hospitals and emergency room to do so. And then, subsequently, we also trying to develop how we can get people tested. The testing of to identify who has been infected. At that time, probably everybody remember, everybody's so afraid to get on subway, to get on the bus, trying to go to the doctor's office because everybody's probably infected. And then you go to the hospital, it's more dangerous than to stay home in the situation. So we invented something called a MRTC, Mobile Rapid Testing Center. We set up the things on the SUV and in the truck that the people who tested the situation will be completely isolated from the people who, provided the service. So we have those things be able to mobile and come to different area of the city, and the people who has unable to come for the testing, elderly and all these people. And this part of these services actually provide a lot of help for the people who cannot get help. And then, from actually in the February, at the time we February, March, we started being provided the vaccination. As Jimmy said, we're doing the Flushing House and round to say it's in the Flushing Hall, town hall, and provided the vaccination. And then we have been provided vaccination, and actually also in Chinatown, Manhattan, and we provide probably more than 2,000 shots for everybody. And actually, we very much wanted to provide more services to help the entire community, not only the Asian community, but everybody else. Sometimes it was just have a funding problem, and because all the money to provide the services come from the Taiwan without any public support. And this is something that I hope that we can get things changed. And we're trying to help our community. This is very important. And we certainly also like to meet Jimmy, and I hope that he's going to be elected for the borough president. He's supporting our community, and this is very important for us to stand to help the service, everything. Thank you so much.
Thank you very much. And it is now my honor to invite to say a few words Eliza Eng, CMO of Kaipa. Thank you very much for your life-saving work over these last very, very difficult months, but we're grateful. So a big round of applause. Thank you very much.
Good afternoon. It's an honor to be here, an honor to serve Kaipa and our community. I will be short. On behalf of 1,000 of our providers, physicians, and other advanced clinical practitioners, we are tired. We are tired. We've been working 24/7 in the last 12 months, seeing our patients dying, getting into a hospital without access to care. We're tired because we know what's effective, vaccines. And we're tired because we see that our patients and many times our families are not getting access to the vaccines. We're also tired because we feel that in some ways the larger community has turned its back on us. Anti-Asian violence is real, and we're living it every day. I recently bought my first pepper spray, and I see it as a big sign of sadness. As an American who's devoted my entire life serving the entire community, regardless of race, color, gender identity. We just ask for all of you to help us and help our community. Thank you.
Thank you. Thank you very much. Incredibly powerful words. So we stand here on multiple fronts, trying to attack multiple pandemics, including this AAPI hatred wave of violent attacks, which is absolutely outrageous. We're going to a vigil tonight to honor the lives of the 4 Sikh individuals who were assassinated in Indianapolis. So thank you again, and for that incredibly powerful statement. And thank you to KAIPA for everything you have done, we continue to do. I want to introduce the 2 folks to my right, and I will go to my immediate right. Ellen Young has been working on behalf of this community for a very, very long time. We used to work together when I worked at the Queens Public Library for many years before I got elected. So please welcome Ellen Young.
Thank you very much. I still remember the days when I was the president of the Queens Library, Friends of Queens Library. Eliza, you're not alone. Believe it or not, I just received the first pepper spray in the mail. Because as a female and an Asian, it put my life in danger. It's very unfortunate. It happened. Well, thank you so much to everyone here today. However, nobody deserves our thanks as much as the wonderful public servants from KAIPA who are here with us right now. Thank you. I remember being right here just over a year ago during those terrifying early days of the COVID-19 pandemic. With these heroes, as they set up one of the very first mobile testing sites in the city, right here. I'm so proud to have been able to provide even a small bit of service to KAIPA's medical professionals as they courageously, at great personal risk, worked on the front lines to provide testing and PPE to our community. Not only did KAIPA provide these services, but so importantly, for our senior and new immigrant communities, they provided them in a way that was language accessible and reflective of our diversity. I have no doubt in my mind the work KAIPA has done throughout this pandemic has saved thousands of lives. Unfortunately, the mistakes of the past that KAIPA has had to set up and compensate for being repeated at this very moment. The first vaccine in this country was given in the middle of December 2020. Flushing has been a COVID hotspot for more than a year, and we only got a dedicated vaccine site at the Flushing Library 1 month ago. Our community has been let down time and time again and has relied on organizations like KAIPA to fill the void at every step of the way. At the very least, KAIPA, having performed these critical services, enormous personal expense, must have these life-saving operations fully funded by the city moving forward. Right now, we need more vaccine doses and language access for our vulnerable populations that have already suffered so much. We cannot continue without learning from our mistakes. Our community needs more. When I'm council member representing this district, Flushing will be never lack a forceful voice demanding the resources it needs. We cannot afford anymore to be last on the list for vital and life-saving medical services. So thank you so much, KAIPA. Thank the community.
Thank you, Ellen. And I've also known John Cho for over 20 years. in his various roles in the community, also when I worked at the Queens Public Library, but thrilled that John could be here. So everyone, please welcome John Cho.
Thank you, Councilor Van Bramer. Thank you, Assemblymember Ron Kim, for providing leadership on this issue. I'm very happy to join KIPA in demanding that the city pay us equal respect, equal resources. We are New Yorkers. We are not second-class citizens. It is not optional to have language access on the vaccine site. It is not optional to protect our senior citizens. It's not optional to protect our immigrants. I join with the frontline staff, the essential workers here, to demand that we be treated with the utmost respect and equal resources that other New Yorkers and other neighborhoods get. Yesterday I found out that one of our zip codes, 11355, is the highest infected zip code in New York. That is unacceptable. Why? Why are we the target of so much government incompetence and disrespect? This is not the last time that you're going to hear from this. The government officials accountable, responsible for this, will be held accountable in the same way that Ron Kim is holding the governor accountable. We're going to hold the mayor accountable for the people who are going to be dying because of his incompetence, his failure to act and provide the resources, the necessary resources for our community. When I am elected the next council member for District 20, I will be working with KIPA and the other community leaders to make sure that we hold these elected officials and government agencies accountable. Thank you so much.
Thank you, John Cho. Thank you, Alan Young. I want to acknowledge Dr. Richard Eng for being here. Thank you so much for KIPA. And all this, every time we do these events, it's because of Charlie and Wei, who have organized all these events every time. So give it up for Charlie. With that, the council member and VP candidate, Jimmy Van Bramer, will take a couple of questions, if you have any.
Also, before I take questions, two things that I forgot. One is incredibly important. So, Assemblymember Kim recognized my mother, who is here today, and I cannot believe that I did not recognize my mother. So, my mother, who is 81 and is amazing, is here. We care for her for several days a week, and she loves to come to events with me. And this morning when she asked me where I was going, I said, we're going to Flushing. And she was very happy that we're coming to Flushing. I just want to say, she is fully vaccinated now, but I know that those websites were impossible to navigate for us, and certainly if English is not your first language or you do not speak English, navigating those sites is almost impossible, and it's absolutely outrageous. My mother also, I'm one of 8 children, I'm number 5, so she is the strongest human being I have ever met in my life. I just have to say that. Second, I forgot to mention, of course, Ellen Young served in the New York State Assembly in the past, and so I want to recognize that very important part of her resume and bio. And let me just say once again, as John so very powerfully said, this is not a problem of the city not having the resources or the ability to do what is right. The city is simply not allocating the resources or doing what is right to protect some of the most vulnerable communities in our city. We could and should and must be relying and supporting, funding, and making sure that organizations like KIPA are vaccination sites and are able to, on a much more dramatic basis, be that trusted resource in this community where folks know they can go, be treated with dignity and respect in a culturally and linguistically competent manner, and receive the care, and in this particular moment, the vaccine, which is absolutely vital. So thank you again, and thank you to Ron and John and Ellen and everyone here. And if there are any questions, we're happy to take them as well, but we will continue to demand that the mayor and the city of New York do the right thing. It is absolutely unforgivable. The level of vaccination that the city of New York is at is not something yet that we should be celebrating. It is good that more and more people are getting vaccinated, but the number of people who still have not been vaccinated is very high, and particularly in BIPOC communities, those numbers are really, really too high. We have to do better. We must do better. So thank you again. And are there any questions from the media for Ron, myself, or my mother? She's a big Mets fan.
That's so Mets.
Yes.
We're good.
All right.
Can we take a picture together?
Yes, let's take a quick photo, everyone. Thank you very much.